over the last 10 years, the treatment options have phenomenally improved. So now we have this anti-VEGF injections laser treatment, where a precise laser beam is used to treat the leaky vessels in the macula. We reserved surgery to bring back the vision in people who completely lose their vision. Hello everyone and welcome to Retina Connect. So in our last video, we looked at what are the test important ones to people who have diabetic retinopathy or detecting diabetic retinopathy. In this video, we will look at the treatment options. It's important for somebody who has diabetic retinopathy. So what are the treatment options that we have? So it is important to know that in the early stages of diabetic retinopathy, you don't need any eye treatment as such. But periodic checkups and follow-ups are very important, because you need to know if there is any progression in the stage of diabetic retinopathy. Along with that, a good glycemic control, that is to maintain your sugar levels, blood pressure, cholesterol, and if any nephropathy or kidney related problems, keep the parameters under good control and periodic follow-ups. So now, when is the eye treatments required is during any of the follow-ups, if there is a progression or if you develop any symptoms due to one of the complications. So the most common complication of diabetic retinopathy is macular edema. We had actually touched upon it in the earlier video. So that is because of the abnormal leaky vessels, the center of the retina, the macula, becomes swollen because of excess fluid, and we have a blurring of vision. So at this stage, this is the most common complication. So what are the treatment that we can give? So over the last 10 years, the treatment options have phenomenally improved. For example, we have the most common treatment is small tiny injections to the eye called as intravitreal injections. And the most common agent is anti-VEGF injections. So now what is VEGF? Is a vascular endothelial growth factor. That is the agent that excessively produced from the damaged retina in diabetic retinopathy, and this excess VEGF is the one which makes the blood vessels leaky and problem. So now we have these anti-VEGF injections, which are nothing but antibodies which binds to the excess VEGF and tackle the issue of leaky vessels. It's important to understand that these injections are not one-time injection and cure, but then with subsequent injections, we are addressing the problem that is causing this abnormal vessels responsible for the macular edema. So now there are cases, now we have very good anti-VEGF agents which last for several months with a single injection. So that is, you are trying to minimize the number of injections with this treatment. So when anti-VEGF injections, which are the regular ones, do not work, then what you do is a intravitreal injection of steroids. So the most common and the safest one is a DEX implant called as Ozurdex injection. So that is reserved for people not usually as a first-line treatment, but people who have had injections before and not so great response. Then we use this steroid injection called as Ozurdex. With that, the advantage, it has advantages, disadvantages. Advantage is that very few number of injections compared to anti-VEGF injections. But there are side effects like eye pressure goes up, which needs to be controlled with a drop medication to keep the eye. But it's not a big problem. It can be easily tackled. So now with injections, the next treatment option is laser treatment. This is basically two types of laser. One for the center, that is macula, and one for the peripheral retina. So what is for the macula is something called as a small laser called focal laser, where a precise laser beam is used to treat the leaky vessels in the macula causing the fluid accumulation. This is called focal laser. This is very small treatment. Whereas in advanced or late stages of the disease, when new vessels start bleeding, we need to ablate the peripheral retina with the PRP laser, which is also called as photocoagulation, pan-retinal photocoagulation or PRP laser. So that is reserved for the later stage or proliferative stage of the diabetic retinopathy. And last options, if the injections and lasers don't work and if somebody goes for a bleeding in the eye, that is vitreous hemorrhage, or somebody goes for a retinal detachment, then we reserved surgery, vitrectomy with silicone oil implantation, that is a keyhole surgery. That is also to bring back the vision in people who completely lose their vision in the late stage because of bleeding or retinal detachment. That will need a small second surgery for removal of silicone oil implant that once the retina is stabilized. So these are the most effective treatment options which restore the vision, even if it's subnormal in most of the patients. I think it helps you, and thank you for your kind attention.